Hello everyone, this is Dr. Kundlas again. Thank you for joining this live podcast on weight loss, medications and strategies. We have been going this journey for last 3 weeks where we have initially first week went over why we eat, what is food, and what are the reasons we overeat, and we explore in detail about hunger. We explore in detail about our satiety signals. We explore hormones, neurotransmitters, social, genetic, evolutionary basis. And then next week we continued that discussion and we went deeper into understanding the different processes, different mechanisms. And now we are at the last part of our podcast where we will be discussing what are the strategies or treatments which are available and what we could, as a medical community and professionals, we could help. As we were discussing, if you have proper diet, exercise, and you take care of all the routines which we discussed in last 2 weeks, you can expect to lose about 15 to 30% of weight, which is a big achievement. And most of the time, most of us can achieve it. And our problem lies is that we cannot maintain those gains. Life gets into our way. We again start having same triggers, emotions, anxieties, depressions, and deadlines. And then there's no question those foods are more palatable or tastier than the healthy food. We need to learn how to make these foods more tastier. Once these things start happening, we go back and we hit a plateau. And that's where we get many patients that I'm doing everything which we need to do. Why I am not sustaining or continuing with all the benefits which we have. So in this podcast, we will be discussing about the medical aspect, both with medicines and pills and surgeries and the common things which are available. Everybody recognizes that obesity is a pandemic and it is not a self-will problem. In the past, everybody used to kind of have a feeling or a process in their mind that it is one of the cardinal sins, like if you're overweight and big, it is sloth. But all have been proven to be wrong. It is a medical disease which, like any other disease, has evolutionary basis, genetic basis, hormonal. As every different disease, like any other disease, you could find everything which exists about obesity. And it is not lack of self-will. That realization lead to recognizing obesity as a disease. So CMS and American Medical Association came up with different ICD-10 codes for different level of obesity. What that did is that medicalize and give legitimacy to this diagnosis. And that set a lot of research that also led to a lot of physician education, health professional education to change the mindset from being a willpower or lack of activity issue to look at really into as a disease process, both evolutionarily, hormonally, and everything which goes into that process. In this podcast, we will be discussing about first how much these different modalities help. Your change in lifestyle, increase activities, exercise can lead to 15 and 30% of weight loss. But many times that weight loss may not be enough, or you hit a plateau and then you cannot continue to lose weight or you start gaining weight. And that is where medical professionals come in. They will evaluate your weight loss journey and they will recommend where you might be making some mistakes and what you could correct. But medications and surgeries are very important part of it. as a medical community, there is a less threshold for these medications, and you will see in every town there is a weight loss clinic, especially with the newer medication coming on, like with GLP, which we'll be discussing in detail. All these medications have kind of sparked a new interest in health and wellness and weight loss. And the goal is not waist size or number of pounds. The whole thing is obesity is a metabolic disease. It leads to both physical problems, arthritis, difficulty in breathing, obstructive sleep apnea, sudden death syndrome, high blood pressure, diabetes, high cholesterol leading to heart attack, stroke, death, and name anything, it can affect it. So there is a bigger understanding and more emphasis to recognize as a medical disease and put in time and effort so that we could treat it and help you in this journey. Let's define how much you should weigh. And this is, we are talking about ideal weight. We don't shoot for ideal weight, but we need to have a target post. We want you to be healthy at a weight where you feel comfortable, at a weight you could function the way you want to function. Above all, chemically, all your blood tests and everything is good. And also, you feel good in yourself. You have a significant boost about yourself. I was in a cruise many years ago, and there was a celebrity on that cruise, and she said one thing which stuck with me for many years. She said, nothing tastes better than feeling skinny. And at that time, it sounded very cliche, and then later on, when I kind of understood it more and more on deeper level, that is very true. We all have a body image, and we want to fit into that body image. And as a medical professional, we want to help you achieve that. Ideal body weight we calculate is, it is a very rough and almost 100% accurate formula. For men, the ideal weight is your height in inches multiplied by 4, and you take out 128. That is what you should be ideally weigh. For ladies, height in inches you multiply by 3.5 and you take out 108. This is what your goalpost is. And second is how much you should eat. This is for presuming this calculation that you have a moderate level of activity and you do not have any other medical problems, and you don't want to gain weight or lose weight. You want to maintain, then you should consume your weight in pounds multiplied by 15. That is your number of calories you should be consuming. But if you are in a journey to lose weight, then you must ensure to decrease your calories by 500. No matter what you do, if you want to continue to lose weight, you must create calorie deficit. If you are not having a calorie deficit, you will not lose weight. This brings to a very important point. Say, for example, if you start on your weight loss journey that you are 220 pounds. Now you have lost 200 pounds. How many calories you should be eating should be calculated based on your current weight, 200 pounds rather than 220. One of the biggest pitfall is we continue to eat the same number of calories. Now you need to decrease the calories based on your current weight, not based on what you used to weigh. And that is one of the biggest pitfall. Then comes in is, what are the latest? We will take this further journey into medical treatments and also the surgical treatments. Medical treatment is that anybody whose body mass index is more than 30, which makes you by definition obese, and you want to lose weight, and you talk to your primary care physician or any of your healthcare professional and you discuss with them, they will consider giving you pharmacological therapy. This is a major change in mindset of healthcare professionals. We didn't have any fundamental guidelines how to do that. And then if you have other comorbidities, Comorbidities are, say, for example, if you have high blood pressure, high cholesterol, diabetes, or you have obstructive sleep apnea, you have difficulty in breathing, you have severe arthritis, where even at a body mass index of 27, it is interfering with your activities of daily life and you don't feel healthy, which we have already established, then you can ask them to provide you with medical treatment. Mind you, medical treatment, we have certain pitfalls which I want to kind of highlight up front. These medications which we will discuss for weight loss, they are becoming more and more safer. The older medications, they were not studied for long-term use. They all were studied for a short-term use, 3 months to 6 months up to 1 year. And after that, we didn't have the safety data. If a few of us recall the fen catastrophe where we were using these medications and a lot of people start losing weight, and then we later on found out those medications were giving heart valve problems, and that medication has to be removed from the market. But we will discuss all the safety and the use of all the medications. Next now is when you should consider surgery. Clearly, if your body mass index is more than 40, you are a candidate for weight loss surgery. But like the way for medicine, you could consider taking at a body mass index of 27. But for surgery, if you have those comorbidities which we highlighted, then you can ask for, or you could be considered for, at a lower body mass index, which is 35. And in very severe complications or diseases where you are having very severe problems, even at a lower BMI 32, 434, you may be a candidate for weight loss surgery. Weight loss surgeries used to be a very feared surgeries, but now with the advent of laparoscopic techniques and we having more experience, and the surgeons have become more and more experienced with surgery. That's one, their personal expertise have improved. Then the sports staff has all the necessary skills which needs to be done, and then recognizing that if we cure somebody's obesity, we will cure somebody's diabetes, high blood pressure, arthritis, joint replacement. So there is always a kind of a constant tussle between getting approvals for these surgeries. Most of the time, your insurance company will give a real hard time if somebody is considering for surgery. I have talked to many medical directors, and actually truth is they are not trying to give you a hard time about these surgeries. Their goal is they want to ensure that these surgeries are being done on the right patient by the right surgeon and the right team. And now that problem is getting solved because more people are getting surgery, and you definitely get better at it. If a surgeon is doing 15 to 20 surgeries per month, he's definitely going to be better than somebody who's doing 1 or 2 surgeries per month. So the frequency and the number of surgeries which are improving, and that is leading to better care. And the teams, before you consider medical treatment or you consider surgical treatment, I want you to have a kind of a way to understand this mechanism, what basically you should consider. The criteria for your health plan and generally accepted criteria by your bariatric centers is that you have done everything for losing weight by changing your lifestyle, you're changing your eating pattern, you have done everything with the surgery. Because what they want to ensure is that they are putting money on somebody who is going to take care of their body in future. That is why there is a lot of red tape. You have to go for a psychiatric examination, you have to go for the social support will be assessed. All these things which you go through what they are trying to ensure is there are enough support system and tools which are available, and you are able to take care of yourself on a proper way. Many times people do not have adequate support system, and they out of frustration which we could start. Yes, these surgeries do help you a lot in improving your long-term health. But if you are very severely overweight, your intraoperative care when you have the surgery and postoperative care and your support system is vital. If you don't have all those ducks in a row, you will have very poor outcome. So they want to make sure you have done everything which you could do in your capacity to get healthier. Because even after surgery, if you go back to your old habits, which we will show in a minute, you can gain all the weight. And that is why with the initial, when these criteria were not very stringent, the people who had these bypass surgeries, the patients start gaining weight and they lost all the benefits. Above all, whenever you go for surgeries, you will have some permanent changes in your life which you need to maintain. You need to be cognizant of your vitamins, minerals, proteins, and you need to have a very strong support system at home. And also you should be able to have access to ongoing bariatric care centers or your primary care physician who are familiar with taking care of the patient after gastric bypass surgery. You will have frequent monitoring. You need to do that. So in addition to lifestyle changes, all this thing you have tried and you have failed. And then there is age criteria too. That age criteria is changing. For medicine, you need to be, when we're giving you medication, you need to be between the age of 18 to 64. But once you are above the age for surgery is 18 to 65. But now, if you are right patient, even after the age of 65, I have patients who have the gastric bypass surgery done because they were very motivated and there was a significantly a proven benefit to do that, and they did very well and they were able to reverse all their chronic diseases. Let's take medications. The fundamental way the medications work is either something has to decrease your appetite, that's number one, or they have to make you fuller quickly, that's the satiety part. And third is it must act somewhere in your mechanism in the gut so that you don't absorb these calories. So first medication out of these three main mechanisms, appetite, satiety, and absorption. The first medication is orlistat. This medication was very prevalent, and I remember when we were in medical school, that is the time this medication come in, and it was very useful. We didn't had much in the way of giving to you guys because there was nothing proven, studied, and there was nothing available. So this was a first medication which come in, and this medication originally was studied for type 2 diabetes mellitus, because what this medication does, you take it, it goes to your gut, and in your gut it works on pancreatic enzymes, and in addition to decreasing the carbohydrate absorption, it also stops the action of pancreatic lipase, which is the enzyme which you need to break fat into simpler fatty acids and glycerol. So what you did is you passed whole fat from your small gut to your large gut, and you had 3 to 5% of your weight loss. But the biggest problem is you do not know at what time you may have a BM, and because all the fat is passing and a lot of people have an anal leak. So it was a very distressing medications for people initially whoever accepted the treatment. They did not stay on this medication for a long time, but it was very, very safe. Now it is even studied long term. I'm not sure who will take it, but a lot of patients who have been studied on this one, they had 3 to 5% of sustained weight loss, and that change is significantly into this part. Next medication is phentermine. Phentermine by itself and also in combination with the topiramate or Topamax, it has been used, and it comes with this Quesemia trade name. Phentermine is a medication which goes to your brain and cut down your appetite. We have the sympathetic and parasympathetic system. This medication works on your sympathetic system and puts you in a fight and flight mode, and you have significant decrease in appetite. You feel very thirsty, you could have palpitation, some people can have high blood pressure. And because of these things which sympathomimetics do, if you already have a high blood pressure and you have palpitations, it becomes a very difficult drug to take. But it is still one of the most prescribed medication, and it is very helpful. I've used in a lot of my patients for short duration, 3 to 6 months. You give this medication, they have a significant drop in appetite, and they could get through your plateau. And also, you support their physiology. In weight loss, we have a known mechanism. When you're trying to lose weight and when you lose some point, you have a set point. Set point is the place where your body mechanisms start changing, your hormones, enzymes, they all changing. Body wants to keep you at the same weight, and your goal is trying to lower it. And we have been able to help a lot of our patients to push through those plateau phase with these medications. Topamax is a medication which was originally studied and is still used a lot for migraine prevention. And when they were doing the trials, they found it out that it's helping people with the satiety. The people are not only, they are less hungrier, but they are feeling fuller quickly. So what they did is, the drug companies, as good they are, they combined both of them and made another weight loss medication out of that. But as I said, dry mouth, constipation is the biggest, but those are mild. Everybody is very different. But this medication is very safe in short term. I don't believe anybody should take beyond 1 year, because yes, there is a lot of data which is coming that it is helpful, but we are not going to push our luck through that. Then this Saxenda was one of the first attempts. We will discuss about Ozempic, Mounjaro, Wegovy. This was the first GLP inhibitor which came in first. And the problem with this medication was it needs to be taken every day. And it was marketed for weight loss. But the beautiful part is now we have better medications, and I have seen some insurance company now, if we can put some sense into medical directors, that this person in the long run will save them a lot more money if we could take care of the risk factors, that this medication will help a lot and they should approve it. Then they will not approve Ozempic, they will approve this medication. And we have used in many patients successfully. Only hitch is that you have to take it every day. Then next medication, which is a combination of naltrexone and buprenorphine. This works, we use this medication a lot in opioid dependence, but it also works on our appetite side and the satiety side, and make you feel fuller and your appetite goes down. And you could expect up to a 10% weight loss. This is like a menu. Some people will be able to take only phentermine, somebody will take Saxenda, and some this medication, naltrexone and buprenorphine. But by and large, they will get you but 10% weight loss. The long-term safety, up to 1 year we know very well, but long-term we will not try. Semaglutide or Wegovy, and then when we use the same medication for diabetes, we sold under the name of Ozempic. These are, so far now, we have experience up to 3 years. Most of the medications which I have told you guys is up to 1 year, but these medication now we have up to a 3-year experience, people taking it without any major problem. The way this works is this medication goes to, when absorbed, It goes to your pancreas, it makes more secretion of insulin and makes your insulin work better and decrease insulin resistance. And there is another hormone which is glucagon and GIP. This works only on glucagon, and that inhibits the production of glucagon. Glucagon is the hormone which raises your sugar. So this medication has been beautifully revolutionized medical weight loss. Plus, it has also revolutionized the treatment of diabetes. In the traditional treatment in the past, when you are diabetic and it's uncontrolled, we have to use insulin. Remember from our last podcast, insulin is the hormone which pushes our carbohydrates to go into and store that fat. The moment we started the patients on insulin, they started gaining weight, and we were nullifying whatever benefit which we are getting by lowering your sugar, but on the other side, your all metabolic stuff was going on. Unless you have diabetic ketoacidosis, this is a condition if your body is too deficient into insulin, this medication have revolutionized. This medication, the way it works out, consider it as a chemical gastric bypass. In addition to working on the hormone, it shrinks the size of your stomach. So your stomach becomes small, and then it goes to your brain in the hypothalamus. They tell them that there is less need for energy, so you feel fuller. Satiety signal comes out quickly, and also your appetite decreases. I've seen many patients reporting that the constant cravings they have, they don't have it with this medication, and they feel comfortable that their whole day is not circling around about procuring food and what they're going to eat it. But these medications are really helpful. It is like having a chemical gastric bypass. There are very few medications which are available to help you if you have some genetic disorder and you're leading to obesity, which basically will be very few cases, and they will not be treated by a primary care physician. They will be in a very specialized center. But for the completion, I just wanted to mention the name. Now, let's go to surgeries. Before you go to surgery, your surgeon, in addition to that you have done everything in lifestyle to lose weight, plus he is going to put you through a lot of medical examination. They want to make sure medically your heart, lung, and your nutrition, your social support system, and psychologically you are able to handle the changes which you have to go. And then they are going to force you to change your habits. They are not going to give you a gastric bypass or any other surgeries, which I will show you in a minute, if you do not stop your risk factors. Remember, these surgeries are not to make you look good. These surgeries are to make you healthy. And the only way they are going to make you healthy is if you change all your risk factors. If you are drinking, that will be one of the requirements they have to do this part. And then your activity has to be permanent. They want to see all these things on a permanent basis. They don't want to give you a surgery. Then once you get the surgery, they want to have your social support system. They want to make sure, because these surgery, most of them are done in surgical centers these days, and you will probably be 90% sent back on the same day home. They want to make sure there will be somebody at home to receive you, to help you with your initial days, and then the nutritional requirements which you will have in the initial phase of trial, you will be able to meet it. And on long-term basis, you must have access to healthcare system, because if you don't have access to healthcare system, on the weight loss, which I want to discuss, I have put together a few videos for you so that you could understand what are the different surgeries are. So far the theme has been, with medication, we have been working to decrease your appetite. We are working to improve your satiety, that you feel fuller quickly, or we are trying to induce that you don't absorb. We played with your pancreatic enzymes to make sure you pass all the calories, carbohydrates, and fats into that. But what we did is now with the surgery, we will be working directly on your anatomy. So the first surgery is this bariatric surgery is gastric bypass surgery. I will show you video and then I will explain what is happening.
This decreases your time in the hospital, produces smaller scars, and helps you recover faster.
My motto has always been that there isn't the best procedure for everyone, but there is the best procedure for you.
Let's understand what gastric bypass surgery is. In gastric bypass surgery at this time, they will show you what are the things going to happen. The surgeon will show you how they will cut part of your stomach, and then they will create a pouch, and they will put the pouch in the different part of intestine and bypass. So what they're doing is they're trying to do in this surgery two things. Number one, they are reducing the size of your stomach. Remember, hunger comes from when your stomach contracts, those hunger pains. The hunger signals goes from your stomach to the brain. So if you have a smaller stomach, your hunger pains will be less because the hormone granule that will go down. So let's look at what they do in gastric bypass surgery.
In gastric bypass surgery, the stomach is reduced to a small pouch about the size of a hard-boiled egg and attached to the small intestine. This increases the flow of food to the small intestine, and this physical change also alters gut hormones that influence feelings of hunger and fullness.
See what is happening. When you eat, you're eating just trying to fill that pouch. Your stomach is bypassed. And then if you see your intestine, the whole intestine is bypassed. So the nutrients cannot be absorbed. That's how you lose a lot of weight. But at the same time, you will find that once this is happening, you will be losing nutrients. So you have to be very careful with protein, vitamins, minerals, which you have to take on a regular basis.
Fullness. The expected weight loss on average is about 30 to 40% of excess body weight in the first 6 months after surgery. Long term, about 50 to 60% of excess weight is off in 10 to 15 years after surgery. There are numerous benefits to the gastric bypass. It's simple to perform, relieves acid reflux, and can cure diabetes. The gastric bypass is reversible, however, this does entail certain risks. The cons of gastric bypass include dumping syndrome, nutritional problems if you don't follow medical advice, and the risk for leak, hernia, or ulcer formation.
There is a second procedure which I want you to see. In this case, we induce this malabsorption or bypassing your intestine to absorb all the nutrients a lot more than what we have done in this procedure. This is called duodenal switch.
In this operation, we remove part of the stomach, about 4/5 of it, to reduce it to a sleeve. We preserve a valve that's called the pylorus, and that has certain advantages in that it prevents dumping as well as ulceration. The expected weight loss with this operation is about 70% long-term. It's the most effective weight loss operation in terms of how much weight a person loses, as well as it's the most effective weight loss operation for diabetics. The operation itself allows a patient to be able to eat more food. The main disadvantages of this operation are patients can be at risk for having vitamin deficiencies, and they have to take special vitamins that might cost more. In addition, if they're not compliant with their diet, they might have excessive diarrhea and foul-smelling stools. The duodenal switch is a more complex operation, and traditionally the complication rate of this operation has been higher than the sleeve gastrectomy or the gastric bypass. I have been performing this operation for 20 years, and now we have significant expertise with this to be able to offer the operation safely.
This operation, now gastric sleeve, which we are going to be discussing, this is the most common and most prevalent procedure is because this gives about 90 to 95% of all the benefits what those two bigger procedures give. And in this, your anatomy is preserved. Yes, it's irreversible, part of the stomach is taken out, but this definitely operatively is a very small surgery as compared to other two which we discussed, but it gives you everything what we need to do, and the surgeons are becoming really good at it. Let's watch.
One of the procedures that we offer is the sleeve gastrectomy, in which 80% of your stomach is removed from your body. The operation works by allowing the ingested food to bypass the stomach and get into your small intestines faster. This quick passage of food into your small intestine is what drives the neurohormonal changes that helps with weight loss. The sleeve gastrectomy allows you to lose anywhere from 50 to 70% of your excess weight. It is the most commonly performed procedure in the US right now. The benefits of the procedure involves the simplicity of the operation, in which it is a relatively quick operation. You can have this operation and not have the fear of developing an ulcer as a result. The other advantage, as opposed to a gastric bypass, is that there is no dumping syndrome. The disadvantages of the sleeve gastrectomy is that the operation does not confer as much weight loss as the other procedures. Another disadvantage is that it is not the most effective therapy for diabetes. Your sleeve stomach may also...
That something needs to be explained. See, for the diabetes is a lot more complicated disease than just weight and eating. It is what he is referring to, which involves the hormones.
also stretch over time, and this may lead to weight regain. Last but not least, even though the sleeve gastrectomy is the least invasive procedure that we perform, it does still have a risk of leak because there is stomach stapling involved. This is an irreversible procedure. In terms of which procedure we will ultimately perform, this will depend upon considering your goals, including the number of pounds that you want to lose, or some of the medical conditions that you may want to resolve. That we have to take in hand with your medical condition, your surgical history, along with your some of your social history, which includes cigarette use, any occupation, or social preferences. And after we kind of put all that into a pot, and we make the best decision on which procedure may be the best for you.
I hope this was helpful. Then now what they have done is, this is the first procedure which Roux-en-Y gastric bypass, the first one which we looked at it. This one was the second one. This is the data about the gastric sleeve gastrectomy. Now, remember in the gastric sleeve, we had half of this, like your stomach is like a watermelon, and they cut it and they turned it to banana shape. This is a newer procedure in which they don't cut your stomach, and there is significantly more and more expertise coming online on this procedure, because on the endoscopic sleeve gastroplasty give you everything what you need like a sleeve gastrectomy. It is a lot less invasive and it's reversible. Let's watch this procedure for a short period of time.
This animation depicts the endoscopic sleeve gastroplasty. The endoscope is inserted through the mouth into the stomach. The aim of this procedure is to reduce the volume of the stomach by approximately 70%, similar to a surgical sleeve gastrectomy. The front and back walls of the stomach are marked to help guide placement of the sutures. Then, the endoscopic suturing system is attached to the endoscope and used to take full thickness bites through the wall of the stomach. We perform a running suture pattern that connects the front and back walls of the stomach. Then, the sutures are tightened, bringing the walls together. This pattern is repeated along the stomach to not only reduce the volume, but also the length of the stomach.
So these procedures are really very helpful, and the technology is improving a lot. We'll continue with these procedures as we go along. This is the band procedure. In this band procedure, what they do is they put a band around where your food pipe enter your stomach, and they control the pressure, how much the food can go into your stomach. To me, that is a beautiful procedure, but let's watch.
In the adjustable laparoscopic gastric banding procedure, a band containing an inflatable balloon is placed around the upper part of the stomach and fixed in place. This creates a small stomach pouch above the band with a very narrow opening to the rest of the stomach. A port is then placed under the skin of the abdomen. A tube connects the port to the band. By injecting or removing fluid through the port, the balloon can be inflated or deflated to adjust the size of the band. Gastric banding restricts the amount of food that your stomach can hold, so you feel full sooner, but it doesn't reduce the absorption of calories and nutrients.
See, the beautiful part about this procedure is there is no reducing. The direct continuity of your intestine is maintained, so there is a less of loss of essential nutrients and minerals, and you maintain this. There is a mini gastric bypass surgery that's similar to what the video which we watched, the first one, which will have this part. There are other procedures where they insert balloons, they create some artificial openings, and they suction out what we eat. Now let's discuss what are the most common nutritional deficiencies which we develop. B12 deficiency is very prevalent, and it is because we are bypassing the area of the intestine where it gets absorbed. So we will check your B12 level on regular basis. You develop very frequently iron deficiency, anemia. You will feel tired, weak. I've seen that the patients who have gone through surgery through a reputed centers and where there is a good post-op care and pre-op consultation and education, these things don't happen because the patients are very well educated. Calcium and vitamin D deficiency can happen. You could develop a folate deficiency. Protein deficiency is very common because once you're bypassing the things and the area of the intestine, that's how it leads to calorie deficit, which we have been trying to create either with lifestyle medications or this way. This is kind of helpful. Next is the zinc deficiency. It is also proven that it happens. Thiamine deficiency is very common, and then all fat soluble vitamin A, D, E, K, they all are helpful. On our channel, we do have the videos for all of these vitamins. If you want to learn more about these vitamins, please look at the playlist. Magnesium deficiency is very common. So we prepared certain questions which we have been getting most of the time. What we can tend to answer now when issued quickly, though we have covered most of these questions in detail. The first set of questions are about all the surgical procedures. What is gastric bypass surgery? As you have seen in the video, in the gastric bypass surgery, your stomach is cut and a pouch is created, and that pouch is anastomosed with the other part of the intestine, bypassing your bigger left part remnant of the stomach and also bypassing the major small intestine. That way what you're doing is your stomach size is decreasing, you have less hunger, and your pouch is small and it can accommodate very little food, and you're bypassing the absorptive area of small intestine, and in that procedure you lose a lot of weight. This is considered a very safe procedure. A lot of people get it, but now gastric sleeve has been getting very prevalent because it gives you everything but 80 to 90% of what you achieve with the gastric bypass surgery. Next question is self-explanatory. How does gastric bypass help with weight loss? It does by decreasing the size of the stomach. Because your bigger watermelon stomach is not participating in hunger now, you don't feel hungry, pouch is small, so you could accommodate a very small meal, and you're bypassing the gut so you can absorb the nutrition or the nutrients which you are passing through that, and you lose a lot of weight. What are the risks involved in gastric bypass surgery? The risks, we always in medicine, we look at the risk preoperatively, intraoperatively, meaning when you're having the surgery, and postoperatively. Preoperatively, we do everything to ensure your heart, lung, your general medical condition, medicine, they all are optimized. During operation, this like any other surgery, your heart, lung, anesthesia complications can happen, and postoperatively, the leak from this, where this anastomosis are being made, that place can start leaking, infection can happen, bleeding can happen, and long-term nutritional deficiencies, which we hit upon that can happen very commonly. How much does gastric bypass surgery cost? I really did not collect any data, But in our area, one of my patients recently had a surgery done in a local center. It was about 15,000. As I alluded in the beginning, insurance companies are more apt to approve your surgery unless they have excluded you right when you bought the policy. So whenever you have your insurance, make sure you have not been excluded or this benefit has not been excluded. But if that is part of your benefits, the insurance will approve it so long as you could prove it to them. A, you have done lifestyle change. B, you have stopped all the unnecessary risk factors, and then you have a support system and you will be able to take care of yourself. Next question is, what is the recovery period after gastric bypass? It is improving significantly. People are being sent home on same day, but how we advance diet from nothing to clear liquid to full dark liquid to semi-solid to solid, it can be up to 2 weeks of continuous observation. You may have to go through that. What are the dietary changes that are required after gastric bypass? Key is volume. You will not be able to accommodate much volume, so you have to smaller volume. That's how you lose weight. And then your quantity and the quality of food has to change. If you can only this much, and if you eat junk and non-nutritional food, nutrition means the food which provides essential vitamin, minerals, fiber, and good quality fats and amino acids and carbohydrates. Next question is, how much weight is expected after bypass? People have lost a lot of weight depending on which procedure, which we went over this thing is, but on an average at 10 years, 30 to 50% of their original weight is expected. Is gastric bypass covered with insurance? I have covered that. Yes, most of the insurance will cover it so long you meet all the criteria. What are the long-term effects of gastric bypass? Vitamins deficiencies, mineral deficiencies, and protein deficiency. Those are the main issues which we see on long-term basis. Can gastric bypass cure type 2 diabetes mellitus? Absolutely. Gastric bypass does. Actually, any weight loss can cure your bypass surgery, but gastric bypass definitely corrects all metabolic effects and by part of that. What are the alternative to gastric bypass surgery? That was my quest to show you alternative procedures. We went with lifestyle change to medical treatment to different surgeries. So I cannot recommend one procedure over the other. This will be above my pay grade. This should be discussed with your bariatric surgeon, and you should individualize which procedure is better for you. How does gastric bypass compare with weight loss surgeries? Weight loss, gastric bypass as a technique has a significant lot more weight loss than the neurogastric sleeve gastrectomy or the gastroplasty, but there is enough weight loss that you have all the benefits. How do I choose right surgeon? A, get recommendation from people who have already gone through this journey. I think they are your best stewards. Second, talk to your primary care physicians. Also, the data about all the physician is in a public domain, so you could look at health grade reviews, their Facebook reviews, and then talk to them. Something in you will tell you whether that surgeon is right for you or not. What lifestyle changes are necessary for gastric bypass surgery? For me as a physician, I have come to realization you must, this understanding that you will need to be continuously monitored by healthcare provider with the frequent blood works, and you adjust your nutrition based on your blood works. Now we have prepared based on the set of questions which we have gotten about the pills. First question was, what are the best over-the-counter weight loss pills? Remember, any weight loss pill which you get from over-the-counter, they are amphetamine derivatives. One way or the other, they are amphetamine derivatives. Our industry about this over-the-counter medication is not as regulated. As far as side effects are concerned, it will be same as if you are taking amphetamine. So I cannot recommend you what is the best medication over-the-counter for weight loss. How does weight loss pills work? Weight loss pills can work only at 3 places. A, they can help you cut down your appetite. B, they can help to cut down your absorption. And third is they make you fuller quickly. Can weight loss pill cause long-term health issues? We truly do not know. Most of the data on all medical pills, safety data, we are very clear up to 1 year. In my personal practice, I never go beyond 6 months because I don't want to err on the side of pushing it to the higher limit. And many times people get angry with me because they have significant success. They feel like their success is being sabotaged, and we are trying to keep you safe. Do weight loss pill eventually help in losing weight? They all will work depending on what suits you. How long should I take a pill? I don't believe any pill should be taken beyond 1 year, but the newer GLPs like Manjaro, Wegovy, or semaglutide, and they all have been, we have a data now up to 3 years. Are there natural alternative to weight loss pills? I cannot recommend any alternative to weight loss pills. What I would say is change your lifestyle, clean your social cues, and if you improve all those, you could expect about 30% weight loss. And believe me, 30% weight loss is a big amount of weight, and that's without any medication, side effects, surgery. That I think has still got to be the core of the treatment. Always problem is me. If I want to correct something, you have to go inside you and find out what you do. Biggest issue which we encounter in primary care practice is it's not what we eat, it's about what we drink. Every day we come across, and I do this calculation every day. If you are consuming this much of any liquid calorie, whether it's a soda, sweet tea, juice, milk, this thing, on average, this is about 140 calories. And if you do every day, and nobody does this much, people are multiple of 3 or 4, but just for discussion, one serving, that of 140 calories, you multiply by 365, that's 51,000 calories, and you divide by 3,500 because 1 pound of weight is 3,500 calories. It's about 14.5 pounds of weight, which we have only from one habit. I think one message which out of these 3 podcasts which I wanted to do was stop consuming liquid calories. If we stop liquid calories, that can change you significantly, and you may not have to do too many changes. What is the difference between fat burner and fat loss pills? They all are trying to do the same thing, either decrease your appetite, increase satiety, or make your body push out the calories through your gut. Certain medications are shown to help to improve your metabolism, especially the thyroid supplements, but they are very unsafe. They can lead to a lot of heart problems, and I will not recommend. How much weight can I expect to lose with weight loss pill? Let's not go in terms of total number of pounds, let's go in terms of percentage. Your lifestyle can get you about 30% weight loss of whatever you weigh today. Medication overall can get you extra 5 to 10 pounds of weight loss, and surgeries is 30 to 70% on top of that. Do weight loss pills work without exercise? Yes, they work independently of each other, but for long-term weight, one is the short-term weight loss, which pills will work, and I have been very clear that all the pills, we don't have long-term safety data. What will get you on long-term is a lifestyle change, your food change, a habit change, triggers change, and exercise is a major part of that. Are there weight loss FDA approved pills? We have gone through all of them, but has been FDA approved. Any medication which we have presented, they all have been FDA approved. I hope this podcast was helpful. Thank you for joining us. My name is Dr. Kundlas. Please like, share, and subscribe to our channel. Please do comment on our content, because this videos and this presentation, I was able to do that because one of my very dear patient, he came in last week and he said, if you don't have something to show me and you are the only one who is talking, that becomes boring, and I really want to thank him. I don't have his permission to shout his name so far, but he knows who he is, and thank you very much. I will continue to improve. Let's learn together. My goal is to simplify healthcare and be of source to you. Thank you very much.